the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This is usually the part of the meeting that if you got something that's not on the agenda, we'll bring it up, or we'll listen to you, but we can't act on it or anything. So is anybody not on the agenda that wants to say something? And that's good. All right, BJ.
Brother.
Come on in.
Do I sit? What's going on?
You can sit.
Okay.
I apologize to everybody for being late.
Well, that's.
Oh,
you weren't.
We're here on the insurance renewal, came back at, the original was 10%. They offered us a 5% no compete. We got that to 3%, which is a really, really strong renewal with Cigna. Obviously last year was an anomaly, we know. I mean, I've got all the years here, we were at the payout, the loss ratio, which means the percentage that you paid out of what you paid in. 2022 was 92, 2021 was 88, so we're in that range. And last year was 162.
Yeah.
So upside down by about $1 million. This year through the end of October, we're right about 90%. With 2 months left, the end of the year is usually the busiest. We thought that 3%, so really, really strong renewal.
Okay. What was it? I mean, I'm gonna backtrack a little bit. Last year we had a situation where was it United?
Yeah.
Was upside down like a couple of
They
million dollars,
refused to
and
bid. Like
did
they
not
said,
bid.
we asked them, well, give us a number, we can take them. And they
Yeah.
said, we don't.
It wasn't the bid after that, because one of the bids was like 30% markup,
35%, 35.3.
and I mean that's about $700,000, I believe.
Yeah.
So
Yeah, you're right about that 2 million mark, so 35% increase would be
Yeah.
700 grand.
So we were lucky I say lucky, but at the end of the year, and I commend your company for doing what they did, because, I mean, I think we came in at 8, was that correct?
Yeah.
And then this year, 3 is what you're saying they'll do if it's a non-compete, and you guys got anything you want to say?
So United Healthcare still doesn't want us, or?
This is, the number that Cigna gave us is that's their number only for a no compete. If we put it out the bid, their number goes back to 10%. And we said, okay, if we put it to bid, are you gonna bid? Like, yeah, if we put it to bid, our bid's 10%. And with them being at 90% with the last 2 months left, you're going to push, it would take one instance for them to have a break even here, which means they don't make any money. Because you're at 90% with November and December left, which are usually the heaviest 2 months.
Everybody's
Obviously,
all their stuff now.
we do whatever you guys want. I mean, you commended us, like last year was a mess and you guys had to make really, really hard decisions, that nobody ever wants to make, so. But, and I know that never gets said, but you saved the taxpayers about $1 million last year, so.
They don't never understand.
Well, you did, so, I'll say it.
And the employees.
No, 100%. Because at some point, if you get to that point, you're going to pass that cost off. I mean, you can't always eat.
What do you think the average annual increase is?
13% is the national average for
insurance
renewal, and they're asking for 3%.
Correct.
It's no brainer.
I kind of feel the same way.
We work really hard, but we work for you, so if you tell us how you want us to proceed, our recommendation would not to be to.
Well, I mean, I don't think we have much choice, I guess, but I would have liked to got back with United Healthcare. I think they do a little bit better job.
I've had United over the years, and I mean, but it's
I would, again, we work for you. Our advice would be this renewal, if you want to have United look at it, having 2 years of numbers like this, because they were gun shy because they lost $1 million on us a couple of years ago. Having 2 years of proof in the pudding, so it wasn't just like, oh, it was just down 1 year, it might jump back up to that 162% a second year, would give us more buying power.
I'm gonna make a recommendation that we accept another year contract with Cigna at 3%. Because even doesn't make sense to even do it if we do it, it's gonna be 10. So.
Well, I think the insurance is gonna go up. across the board anyway, no matter what you do, so I doubt we'll get a better
That's a really good
better
number.
deal than 3%, so.
It's a really good
Well,
number.
even working at UPS, I mean, it was normally a 3 or 4% every year, but, and, you know, they're partially self-insured, so, but it's still, it never went any higher than that, but that's, to me, that was always the average, so.
Okay.
So I'll entertain a motion to accept, the 3% from Cigna.
I'll make a motion.
Randy makes that motion, Greg?
I'll second.
Greg seconds that, and I'll make that unanimous, so appreciate your work.
Jennifer has a sheet.
Yes.
We don't have to have, you don't do it now if you don't want to.
I want to say
We'll
it's-
sign it.
it's
If you
ready.
do, I'll hand it over. If you don't, you can send it to us.
Well, again, I appreciate your company's, and I'm gonna say above and beyond last year, because we were in a pickle.
It was new for us.
And I know you were pulling your hair out, we were pulling our hair out, and it was the end of the year, and I know we had multiple meetings about it. I appreciated what you guys did.
Your
so.
employees understand that you couldn't, I know we can't get too deep into it, but you couldn't make a move until we solved
You need a copy of that?
the 162%.
Yeah.
Wasn't like we just said, oh, it's December, what are we gonna do now? This was 3 months of saying, what can we do?
Yeah.
And again,
I think it was definitely a win for the county and the county employees and the county taxpayers, even though they will never
Well,
understand it.
kudos to you for,
So,
you all made tough decisions, so.
but again, I appreciate your guys and.
You guys do a good job.
Thanks.
Okay. Thank you.
Thank you.
Appreciate
Um,
it.
And quit sending pictures of those big
Yeah, she'll make
animals.
a
Okay,
Mario have a copy,
He's
have
got
the
it.
original.
I'll have to go to his Facebook page.
We went on an all-dad hunt, me and the boys and my brother,
Oh.
last week in Texas. It was pretty awesome.
All right, moving along, property and liability bids.
It's okay. The
That'd
one
be great,
Ashley
yes,
signed,
that'd be
you
fine,
got it,
yes.
okay?
We don't have any.
Huh?
I don't think we have any. Nothing was turned in.
Are you serious?
I didn't ask before I left, I messaged the girls, I'm like, no, we don't have any record of anything, there's
Well,
nothing
then we'll
started.
table it till the next time.
Yeah.
So, that's interesting.
Yeah, it was, wasn't it?
Even the current.
Nothing.
Guess I'll make some phone
You
calls.
need my signature.
Yes,
All right, we're
please. That
gonna
was,
move
that
on.
was approved last.
Table, the property insurance. Kevin,
Thank you.
she said nobody turned anything in. They were due last Wednesday.
Yeah, they were due for 25th.
That's weird.
Consider how many phone calls I got.
Oh.
It sure was. Certainly was.
Yeah. That just don't make any sense. Even our current one didn't turn anything in. And the one that, wanted to know when to turn it in, so I guess we'll have to make some phone calls. Well, I guess I'm gonna say this, and whether, I guess you can test this. If no one turned in a bid, then we just renew with the company we have, so, right?
We could exercise that option, but I think we need to get with our current agent and see what but the RFPs were available, people came and picked them up, right?
I know one was, yeah.
Um,
Our current one provided it, and then we had another one that picked it up.
And we advertised it. I would normally suggest not tabling opening bids, because you advertise for a specific opening date. But under the circumstances, we don't have anything open, so. Yes.
Alright, well, we're gonna do that. Maybe we reach out to at least two of the players that said they were bidding and see if they were turning something in or not. So. All right, back to Kevin.
Alright, what I have first is, a supplement for our bridge inspection contract. There was a few bridges I found that has to have, the weight investigated or changed on the tonnage. So basically it's 36,356, which is on the 80-20 split. I really don't know choices kind of federally mandated. It's just a supplement to it. Two of them that are the same.
We had the outage. I don't know what kind of.
Yeah, the outage and, been done.
Back on.
Sorry, back on. Yeah, back on around noon, but they didn't lose. Think it all went well.
Good. Well, I was out there and saw some of the I-beams piled in, so. That's a plus. Hopefully he's got good weather where he can continue to move along.
That'd be important. Hopefully it stays good. No big rain.
Okay. Comments or? Randy, you got anything on this?
No, I don't think we need it.
All right. This is for the inventory.
Yeah, it's, some of the weights need to be added and changed, engineered. Some things I found during inspections. And like I said, that's part of the 80-20 split, so really 20% of that's from the county, which we've already budgeted to. 80% federally.
And they're doing it now. Or they have been doing it.
Phase 2, we're doing it right now.
All right, I'll entertain a motion to accept the supplemental agreement.
I'll make the motion.
Randy makes a motion, Greg.
I'll second.
Greg seconds that, I'll make that unanimous.
The same thing.
Huh?
It's up to you.
But, yeah, that's the same
How
thing.
many did they find?
You know what, I about to say, I'm not.
Oh, sure, no, you signed one on
That'd be proactive.
I haven't sent it to that, or,
that. I guess sign
if
up.
I did, I haven't opened it
She
yet.
can have it. What else you got?
The only other thing I have is, Silicon submitted this for their, annual bids. And, they would like to just roll over their bid from last year to this year. So they want to hold their prices the same. To my understanding, they can do that up to 3 times if you all agree. I'll send this to you. You can send it to me tomorrow if you want to.
Want me just to email? Oh, yeah.
There's two of
This is
them.
the same thing.
I know, but we
signed.
signed
Oh, did
both,
you?
so you don't have to have her send.
You guys sign it too.
Oh, okay. I guess. I can-
Did we redo an invitation for bids?
December 6th is when they're actually, they close bids, they're actually due. This is Silicon's they're just wanting to roll over their 22 annual bid.
I don't
And keep the
necessarily
same
see
price.
I don't see a problem with it, but I would just say, let's don't do anything, let's don't act on it until we get to it.
So we do it on December 6th.
Yeah.
We could do that as long
Hey,
as
Kevin.
they just brought it to me, so.
Kevin, just trading.
Did we,
And we've always done it in this circumstance and accept all bids.
You want,
Situation, right?
yeah.
Thank you.
did we find out anything about an invoice for the signs that were tore up on Pleasant Ridge.
No, I'm still working on it. I got working on the federal aid thing. Actually, I ain't got back to it, but I'll get you some numbers here for a month long. That didn't have any at the office because that was a breakaway. I wanted to get the price on them, they're considerably higher, so I wanted to kind of get a true price on it, to be honest with you. We had the prices for the pole we usually use, but we'll see if we can get a good price on it. So, I think that's about all I got. The only other thing is, we gotta do the ordinance for, the bridge out in Leota. I'm gonna send to Zach tomorrow, so we'll be working on that. We'll get the speed limit down to 45. So.
Got a question about that, cause I talked to another commissioner, in another county. He's saying that if, and I asked Kevin this question, Zach, I'm posing this to you. If he's saying that every road in Washington County is 45 miles an hour, and the reason being is that, hear me out first. He said that if they, and I've heard this from other people, is that if you post the road and this all roads, that you can actually put it at 45 miles an hour.
You could, if you do a speed study for all roads.
He's saying they don't have to.
I touched base with that consultant there, he said the same thing. Every road had to have a speed study on it.
Alright.
He said the ordinance you could make it, he said, but it wouldn't.
You could make it.
It wouldn't be any good on it.
No, he said they do enforce it, so I guess I'll research it a little bit more and ask him
Yeah,
what he.
I mean, I think we've run into this problem a couple times, and I think it's great to reach out to other communities and see what solutions might exist in particular situations. I will tell you that just because somebody did it, doesn't mean it's right.
Well, I get that too, cause I mean, he may have some legal advice that says, oh yeah, sure, go ahead. But he's saying they're writing tickets, so.
I think we probably should go ahead. I think it'll be fun. We can't stop them from running 70, so we might as well put up a sign that says 45.
They knock it down too, right?
Alright, I'll check into it.
Oh, I seen Minix Drive was on there, or something.
Yeah, we've already kind
Fair enough.
of, already went through that.
Good enough.
Somebody's gonna need some bad news. Alright, Ben.
It's all good tonight, guys.
Take care. Maybe see you Friday.
Run Randy off.
About purchasing a vehicle.
Okay.
On my 24 budget, they gave me 45,000 for one vehicle. What I found, the truck that I'm shooting for is $50,940. Did not realize that it went over the 50,000 where I need 3 quotes on it. But what I was proposing, what I'm asking you guys to give me permission to do, is on my maintenance on this year's budget, I was able to save quite a bit of that. What I'd like to do is go to the county council next week, or next week or the week after.
Yeah, it'll be the 14th, yeah.
And take money out of 3 lines to put a down payment on this vehicle this year, out of this year's budget, and then that clears me for the full vehicle on next year's budget. And they actually proposed if I do that we could take possession of the vehicle this year instead of waiting until the first of the year on it. The second part of this is, when I was there, I went ahead and just had them drive the Explorer that I'm driving to see what a trade-in would be on it. They offered 3, is what they offered, so.
Well, that's some of your money there.
Yeah, so if that is what you want me to do, then I don't even need but about half of this year's budget money if we do that. And I didn't know if that changes our situation, if there's, because it wouldn't be a $50,000 purchase. Technically, if we trade in a vehicle, it'd be a $47,000 purchase.
How many miles do you have on your vehicle?
On the vehicle outside, it's got 102,000.
102?
Above 50K, you're
That's
just
V6.
testing.
Well, he's got different quotes.
We don't have enough.
I have a quote on the truck that I'm looking at. The truck, a step down from the same dealership. Downstairs on the computer, I have a Chevrolet quote on the same basic trucks, but I don't have three. I didn't realize that until a few minutes ago.
Yeah,
that they went up.
I mean, to be fair, we're just above the threshold issue, but the statute says that if the purchasing agent expects the purchase to exceed, so it's not
If it
if it does, if it's, you know, you build in some cushion room on both sides, so.
The deal with the vehicle I'm driving right now, it seemed low to me on the trade-in. I just put $1,200 worth of tires on it 5 months ago. But the one thing that's knocking it, you can see all the EMS lettering where it was a pursuit vehicle. All that you can see, the fade. And it's got all them holes in the dash and stuff where they had switches for their sirens and their lights and stuff. So if they didn't have that, I'd be like, that's crazy. There's no way it's worth more than that. But I would buy it for $3,000 personally. But when you go to sell it, it's gonna be somebody wanting it to drive as a daily work vehicle.
I think too, it's good to do it as a trade-in. I think it is good to do a trade-in on a county vehicle like that. It does not get us free of the quoting requirement.
I would say on your vehicle now, that we put it on Gov Deals.
Do what now?
Put it on Gov Deals.
Yeah, you could also do an auction-based.
Get with Kevin and have him just put it on there.
Yeah.
Yeah, it's like, I didn't know which way you guys would wanna do it.
Well, I mean-
If somebody mentioned something about having a backup vehicle in the county to move it somewhere else, or,
Now, we're getting out of it.
that's what I kinda figured.
But,
I think we'll get a
but
little
you can go, like Randy says, that Gov auction, and if it doesn't bring the 3,000, then they'll sell it, you
Yeah,
know?
Well, here's the thing, somebody next year is gonna want to trade a vehicle in, or gonna want another vehicle. So if we have to park yours for a little while and let you buy a vehicle, and then trade two vehicles in on one, you know, you see where I'm going with that? We got time to play, I think we put it on Gov Deals and just see what we can do with it, cause I think it'll be more than 3,000.
yeah, and, you know, they did what they called a quote, cause I had to hang around for a couple hours, and I guess they just put it out there and see what dealerships, used car lots would offer them on it, and that's what they come up.
Right.
And that's how I I figured it'd put it on their lot.
So I seen you had three quotes. So, why don't we
And it
just,
says at least.
why don't we just table it till, here's what I suggest, table it, we're gonna table it. You go get your three quotes, and then, and then go to council meeting before our meeting, next meeting, and say, hey, can you move this, and like what you're talking about, and then come back to us at our next meeting, you'll have that answer from them, and then we can make a decision on, you know, which way to go. So,
Yeah, I thought since I was down there, I might as well go ahead and get a trade-in value on it, cause I knew everybody was getting there's been some talk about too many sitting around and this and that, but like I said, it seemed low to me, but I'm not in the used car business, so I don't know how all that works, so.
but I think you can put it on there, like Randy says, put it on there, and then.
So you think I would just go to Kevin and talk to him, and, cause he does that quite a
He's done
bit.
it several times.
Yeah.
He's got more money than what he thought he was gonna get for a while, then. So,
Yeah.
Yeah. Stupid money.
The car is straight and everything, it's not beat up, it's not rusted, you know, or anything like
I'm
that.
surprised that TMS driving it.
Yeah, but the one thing is it's leather seats, and the back seats are black and I know it's from their toolboxes, you know, their kids and stuff like
They got
that.
knuckle prints on the dash.
No, I haven't seen
Arrange a
it.
cup holder just to fill up with water.
Alright, that's what we'll do then, but you alright though?
So you want me to go ahead to the council, see if they're gonna even let me move this money around, and then if they do, and we do sell it, that'll be in excess of next year's budget
Okay.
on it, and I thought that was the way to go, the way I was seeing it, so did a little legwork, but get a better deal, so.
I agree.
And then, Zach, you wanted to bring up,
Oh, yes, we have, received a submission for cell phone stipend request.
Oh, we already did.
Yeah, it was actually approved last month.
We just needed the resolution.
That's correct.
Yeah, just
It's
need the
already been
signature.
Then done that, we're good, we just need to execute and sign.
so I'm gonna get on the agenda for next meeting, I'll have a little more information,
Bring us 3 quotes.
3 quotes. Good enough,
Alright, thanks, sir.
thank you.
Appreciate it.
Did I miss a meeting?
Yeah, you were in trial. Then Harrison County.
Oh, that's right.
Under Arson. Oh my goodness.
I haven't been here in 3 months, I don't hear.
You know what?
I haven't been here in 3 months. No, it's
I don't know if that's a good thing or not.
Welcome, ladies.
Thank you. Thanks, everybody.
We're harmless here.
Appreciate it.
Alright, first thing I just wanna go over, I haven't been here in a couple months, is our financial situation real quick. October, we brought in 234, training's at 29.3, paramedics at 77, and that class is not, it's closed financially, but it's not completed. Currently, our cash ledger's sitting at $820,512, and we have a $227,000 deposit, or $233,000 deposit sitting, which will put me at $1.05 million in my cash ledger for the year. As you can see, since the beginning of the year, that's a $461,000 increase, and since I've been here, it's a $927,000 increase, so that's where we're at.
That's positive.
Financials, I've started putting projected on the second page. You can see where our end of year projection is, where we finished in 2022, where our growth's at, where our runs are at currently, projection at the end of the year, where we finished last year, which shows that as of right now, we're down 3%. Overall, but we're up 19% on our financial status. Any questions about?
So we're doing
financials?
less business, but we're making more money.
Yep,
That's positive.
you're welcome.
Okay, that is very positive.
All right. The reason that they're up here, the first thing we'll cover, so they can bounce if they want to, is, was it the 1st or the 30th or?
It was, 9:30 at 12:01, precisely. 3
Norton,
days ago.
Norton acquired Scott.
Yeah, no,
Since then, this is, for clarification, this is no shade on the hospital, this is nothing, I'm not complaining, this is an informative thing for me only. Initially, our average runs, transfers out of that hospital were about 4.2 a day. Right now, currently to date, from this last month, I'm sitting at 7.8. I'm running 4 and 5 trucks a day. I'm not sure if you have noticed on my payroll, it is significantly in the amount of $8,000 to $12,000 higher because I am having to run these 4th and 5th trucks. I'm not here asking for money. I'm not here respectfully asking for permission. I'm just letting you know what's going on right now because of the status with the hospital. As of right now, I've got the money to float. I don't want to say float, where we have those grants and stuff. I've got the money to cover. It's still going to cost me the money. It was money that I wasn't going to initially spend. But this is, I've still got 8 weeks left at an extra 10 grand. I mean, we're looking at $80,000 to $100,000 that I wasn't initially planning on spending in payroll. If this trend continues. Again, this isn't me at the hospital. This isn't me anything. We're doing what we're doing, but I'm running 4 and 5 trucks a day. Right now, I've got 5 trucks stood up. Yesterday yesterday wasn't. The day before, I had it for 6 hours, and Sunday we had it for over 8. That we're running 4 and 5 trucks. So there is going to be a huge financial difference in my payroll. We're jumping up 8 to 10 grand.
Well,
I think Sunday we had 7 or 8 transfers.
We had 8
Monday,
transfers Sunday,
seven
transfers.
on Monday, and they're all, and the problem is, it's not necessarily that there's 7 or 8, it's that on Monday, they all dropped within like 3 hours, so I mean, I've got 7 to get out in that amount of
But
time.
as far as, I mean, I know you're talking about wages and the like. I mean, these are revenue-driven transfers, correct?
Some of them, I mean, there's some self-pay ones in there too, I know that a couple of them Monday are self-pay, a couple, I think one of them Sunday was self-pay. I mean, I can't
I know.
guarantee that they're going to be.
No, I'm just saying can be some offset.
There is some offset there, but obviously the way that my budget works, which Kathy and I have spoke, is not the way that the hospitals work. Like if I have a good month, my budget just doesn't, increase for the next month. I'm set January 1st for the entire year. So I'm having to get down to the end of the year with money that I didn't project to spend because we've never trended that high. And now I'm spending, like I said, 8 to 10 more a week or a payroll in these transfers. So I think, like I said, I'm having the ability, hopefully, to cover. I don't want to say I can because I'm not going to sit here and promise you something I don't know because I don't know how long this is going to go. It looks like I will be able to cover, but I'm just letting you know right now what's going on.
So there's been a rash of transfers.
So Nick was kind with Matt yesterday to discuss today's meeting too, to kind of review it. But as the hospital, and as we get into the winter months too, you do get sicker patients. But with us becoming part of Norton Healthcare, and those of you that know Norton, they're known for their quality. So we're really taking this time to pause and look to see how do we bring in Norton policies and procedures, and how do we work with them to get the specialists here that we don't have in our community. Norton is their number one focus, and I think you all heard when you attended, is keeping care close to home. That's something that we haven't been able to, we've worked towards it, but we haven't been able to quite attain that. So we're working towards that right now. So we're in a period where we are transferring out a little bit more patients, one due to the acuity of the patients, and then the other is just us trying to realign our scope of practice and what we can care for. So, with those coming in, like he said, he had several come in at the same time. We don't have control when a patient walks in and when they don't. So we're not trying to, I know we've had conversations before about is the team stacking patients, and we've worked out really good relationships. We're not having that situation. It's just the timing of the patients coming in. But we have had an increase in transfers. So Kathleen Exline is our Chief Administrative Officer now for both Clark and Scott. So she brings 16 years with Norton Healthcare?
30 years in healthcare and 16 at Norton Healthcare.
So one of the things when Nick came to me yesterday and I had talked to Kathleen about today's meeting, I'm like, hey, can you go with me? You know more of the Norton standpoint, where I know more of the Scott and Nick relationship and the county relationship. And she worked with, they do have a transport team that runs out of Norton Healthcare. They only transfer between Norton facilities. And we weren't sure if they had an Indiana license or not, but that's where we can maybe supplement on days that Nick isn't able to get all those transfers. We can work with the Norton transport team to come up and help take some of those transfers down.
I would say 33 days in, we have a very experienced chief nursing officer that's skill building the staff's knowledge and ability. I would also say that Norton does not employ team health, who covers services for both the emergency department and the hospitalist. And so they actually have a new leader who we did a call last week with, and just really described our areas of opportunity just operationally. We'd love nothing more than to keep the patients here. I guess the bigger picture is we have to teach the patients in our community when to get the right care where. And so I don't have control over that. I will say that you both were there and you heard Mr. Cox, and he's committed to Scott County. He's committed to make sure that patients get the care they need. And so I would just offer respectfully, if your mother was having an issue and she lives in this county, and she needs to be taken to a Norton facility in Louisville, or she needs to be taken to Clark Hospital. So I'm just saying, how do we come together and accommodate that the budget can be met or exceeded, but that we're also serving our community, which that's our, I think we met with Nick on October 24th, and we agreed our job is to serve our patients. So I guess that's where I feel like that I can't answer if the increased transports are due to more patients having issues, people seeing the blue end, people having more issues. I can't control when the patients come in. And so quite frankly, I made some calls today just because I knew we were coming. And I just asked our transport team, who I was accountable for several years before I came into this role interimly, and I said, hey, if you're certified and all those things are in order, I understood from our meeting on 10/24, Nick said that even though it's a closed county, if he gives permission to do so, that we could come and transport the patient. So that's really where, at game's end, I think we all want the patients to stay at Scott Hospital, but we're just not really in that place quite yet. And honestly, it's a critical access hospital. So we have to honor our patients' choices. And so if patients come to Scott Hospital and they want to come to a Norton facility, I think we all need to work together to honor that choice. And if really our goal is to provide care in Scott's community, then I would want the patients brought here for us to try and work that out. That would be my only ask.
The ask that I had to Russ Comer, which is the president of the hospital board, and was that, because in the initial, Norton's, taking over, is that, and I heard that they had a transport, I guess facility or department, I guess, is that they don't interrupt in our private, or I won't say private, it's a county-wide EMS service, which is second to none. And I was sure that that wasn't gonna happen.
Oh, and let's be clear, we're not.
No, and that's where I'm getting at. I'm just saying that if there's an overflow situation where, we can't, maybe we do that, I don't know.
Honestly, it's a revenue generator, and similarly, the hospital's in the same position. When we have patients that are self-pay, we might not get paid for those either.
Yeah.
So I guess that's where, we're not coming in to any way say that we're gonna come into the county uninvited. We're clear it's a closed county. Our intent is not to put an ambulance service here, but our intent is to serve the patients of this community to our best ability.
And respectfully, I've been doing that since I've been here, and the service has been doing that since 2005. And I mean, we've been dealing with the hospital. I've dealt with the hospital personally for going on 11 years. I know that my team does an exceptional job about transporting the patients where they need, and just where they need to go. And you and I have had lengthy conversations about, not bypassing Scott or bypassing Scott or.
I want to validate to our commissioners, I never insinuated that you didn't.
No,
I stated that Norton's position is that we're gonna honor patients' wishes. So that's where I think, how do we come together to determine that solution? If that solution is that increased resourcing for the current ambulance service isn't an option, then how do we come together to figure that option out? Because, we'd love nothing more than to have a census of 25 at that hospital, and that's our ultimate goal. We'd love to see surgical care happen there. We'd love to see a lot of services brought to the hospital that I think that the commissioners would, I would think you all would desire that we're providing safe care. So that's where I guess I'm coming from, that I appreciate the transparency of where the fiscal issue is. I think we're willing to just bring a solution to say, in the event that the burden is excessive, how do we work together to say, how do we figure out getting the patients out?
And I respect that, but respectfully, I found out about the solution about 20 minutes ago, and that's just why I'm here to letting them know where my financial standpoint is. The issue hasn't been getting the transfers out. We've exceeded on that. The issue is it's costing me money that isn't projected.
Sure. I would say on 10/24, I did mention to Nick at that time that I realized it was a closed county, and he mentioned to me, only if we don't give you permission. And at that time, I said, our transport group could be an option.
And I want to go out on a limb here and say that we have met the standard. We met the standard all week with the surplus of transfers. We're still advocating for these patients. We're still getting them out. We're just coming to you and saying that budget-wise, we're spending money that's not projected. We have the option to allow the transport team to come up here if it's needed. I think we can both agree that's not needed right now.
So
just letting
that's
you know.
one question I have too, because I know Nick, I asked him this week, because Kentucky has a standard of transfers that they have to be out in X amount of time. So Nick said Indiana doesn't have that set transfer. So what is your average right now for transfers getting out? I know we have some that held for 5 and 6 hours.
Yeah, I mean, it depends on if you're sending out 5 at a time or 1 at a time. I mean,
Yeah.
like right now, you got 1 sitting, but
Because it depends on
you
the
drop 2
patient too.
and, yeah, I mean,
If it's a med surg patient that's waiting, they can wait 5, 6 hours. If it's somebody that is an ICU patient, I don't want them sitting there for 5 or 6 hours.
No, and typically they don't. I mean, like I said, I'm juggling a hospital and 25,000 people. I mean, I don't have the ability or the luxury to dedicate all my resources to one area. And we do our best with the trucks that I've got and the people that I've got to do so. My thing was just informing you, my budget or my expenditures are going up. Because there's just less admits to the hospital, more is going out, because that's what it comes down to.
So
Is this something we may need to have
if you
get together and have a meeting?
reach the point in transfers that you can no longer transfer somebody for whatever reason, what would it take for you guys?
I tell them, call whoever they want at that point. And typically, in history, I won't say what always happens, in history, I get a call back in a half hour to say, we can't get anybody to do it, when can you get here? Now, Switzerland County does have a service that picks up, they're typically BLS only, so, and according to my sheet, about 60% of the transfers that go to the hospital are ALS, so that doesn't help me on those. Again, it's dependent on the day. There's some days that there's 2 transfers, there's some days that there's 10. All I'm telling you is historically, Sunday was 8, Monday was 7, Tuesday was 5, today there's been 3. And when we're talking about this, we have to remember, those 8 runs is my trucks on the road. That one, I won't say one truck, but it is a truck on the road for 24 hours. That means I have a truck. So I am down to covering this county, hour-wise, with 2 trucks. Because my average turnaround time for a transfer to Norton's downtown is 2 hours and 47 minutes. That's from door in to back at station. Because, when we unload at Norton, I'm not available from 40 miles away. I can't respond code 3 to Lexington from Norton. I have to get back to this county.
Try to understand why we're having this conversation right now. Is it that Norton's is, I guess, upset that they have patients sitting, or what?
I think we were contacted and said there was a commissioner meeting.
I contacted them because last time that I was here, some stuff got misconstrued on how I said it, and I wanted them to have the ability to be here. Because the only thing I'm here letting you know, my payroll's going up $10,000 to $12,000 a week.
I mean, I feel like.
So everything is still running.
It's functioning, it's just
like it always
expensive.
has, but you've got more trucks on the road.
I'm running 5 trucks a
Well,
week.
I feel like
in any
that-
business, you have ups and downs, and it could be a certain, I mean, you may not have 3 next week, I mean, or next tomorrow.
I'm just letting you know, for the last several weeks, we've been having more units out consistently.
And again, I know Nick has contacted me about this before and said, hey, we just made transfers, we can't handle them, and he does what he says he does. Call somebody else.
I'm with that, yeah.
So if everybody's fine, I mean, and you're just saying you're gonna spend more money, then that's fine.
I would say I know the history of the hospital, and the census really has not been more than 5 to 8 patients. And so it's not as though patient volumes have fallen off. What we've seen is an increase of patients coming to the hospital, and I won't deny, it could very well be because of the acquisition. I can't say it is or isn't, but I think that's where I'm gonna tell you, I feel like it is cooperative. So we went on 10/24, and I have a liaison that visited with Nick and brought books by 4 days ago.
Yep.
So I mean, I don't feel like it's contentious. I
Okay,
feel like
that's where
we're
I was trying to figure out.
No, I feel like we're trying to work through it. I'm just
Okay.
saying that when someone tells me something's a closed county, I'm gonna treat that and I'm gonna respect it, because legally that's the law, right? I'm just saying that we're foraging forward on a solution that if his capacity exceeds his ability, we're gonna offer that up as an option.
I get that, and I was there that day, and I did hear some positive things about bringing some services here that people are being transported for elsewhere. So if we can build that back up to where, whether it's a broken bone or ortho or somebody else, that we're not all transporting everybody that goes through the ER, so.
Yeah, and I would say at the end of the day, our community getting services at the right time is gonna prevent unnecessary visits to the emergency department. And primary care is something we're very committed to on how we can bring that to the community. So I just appreciate everyone's listening here.
Okay, all right. Good question. Like you said, historically, you know, in the winter months, there's gonna be more transfers. I mean, do you see at fall to the end of the year being busier? Or does it stay the same to through the first of the year historically? What?
Healthcare, it goes and, you know, flu season historically before COVID, we ramped up staffing, knowing coming into the holidays, because everybody gets together and they share more than just food and their families. But historically, healthcare inpatient volume, you're gonna start ramping up in November, December, January, February. It kind of depends on how the season goes and when flu actually hit. Now, I mean, we had some flu patients in August coming in the ER. So I'm not sure to how to exactly answer your question, but November, December, January is usually our higher months with admissions and sicker patients.
So, you know, you're doing good now. What's January look like for you?
That is why I'm here,
And we don't know.
that's all that this was. I don't, respectfully, I don't know how close or how much, I know you have 26 or whatever departments to worry about, I'm one of them. I just was letting you know, normally I'm turning in payroll 50 grand and now it's hitting 60 plus. And I don't, respectfully, I just didn't want the backlash of, I'm over here blowing money because I got it at the end of the year. That's not why I'm doing it, it's.
Well, okay, here, so my question, I tried not to say this, but, so my question is, has the council done anything that will interfere with you being able to do this in January, February?
So my budget is to the penny of what I need, with about 3% leeway of excess, just overtime and stuff like that.
I mean, tell me if I'm wrong, but what you're in your report here earlier said you had 800,000 and you're gonna have over $1 million. That's,
hopefully.
You know, he's not like,
I don't get front
he's
loaded.
gonna have that money in his account, where it's years past he didn't have that money, and wait, you know.
I'd have to get an additional appropriation towards the end of the year from my own
he's in
account.
better shape than we have been in the past to be able
But I didn't know
to
if
absorb that money.
I didn't
They
know
can't
whether or not
touch
the
it.
council was gonna make him pay for anything more.
My responsibility is higher this year.
That's where I was going with that.
Yeah.
Yes, I mean,
But I think,
I'm responsible for
I guess
96%
it's
of
up to
my
you.
budget.
If you see, I mean, I know you talk to him quite often.
Yeah.
So if there is a situation where, you know, something's upside down or sideways or whatever, let us, you know.
I just, like I said, I know there's been calls in the past, you and I have
Oh,
talked of
I've
why
had-
is this person sitting
I've had to
there, and I
call.
said, I can only take 1 or 2 people at a time, I can't take 5, we've had that conversation.
I've had to call and take radios away from people because
Mhm.
they didn't understand, you know, situations, so.
Yep, and, you know, I just, like I said, you and I have had the conversations about why people are sitting,
Yep.
stuff like that, and
I
it's
get
just, I'm one person with 3 trucks. I mean, I have 5, 6, but, you know, I can't expect everybody to come in on their off days, and I can't sit here and say that I can always staff 5 trucks, because I can't.
So it sounds like there's an avenue that you run into that, so.
Now that I know that, that will help.
Nick, I have full confidence in you, and I know that you're doing your utmost best to try to
This is how you get things done.
juggle all the balls that you have going, and I know that you'll continue to do that no matter what. as long as you're doing. You guys, I appreciate Norton here, Healthcare coming to Scott County, and
We're excited.
How's things going? I mean.
thank you very much for coming.
You know, we're 33 days in, and today marks that all 1,300 employees are on Norton's payroll system. By Friday, we're gonna have them benefited twice over. So we had to do benefits for 2 months, and then we have to do benefits for next year. We are looking at the wage disparity. That was the next thing that was on my list, to really make sure that we have right-sized wages for both the employees of Scott Hospital as well as Clark and the medical groups. I mean, I think our next big thing next year for this county is gonna be how we infuse primary care, how we bring those specialty clinics, and really, my big goal in '24 for that hospital is how do we bring surgeries back? And so how do we bring the appropriate surgeries so that people can get their surgery here, be cared for safely, and be able to not leave the county? So I think that's probably the biggest thing I would say, but primary care is first on the list.
I know you guys offer a tremendous amount of services out there that really folks don't really know, right?
Yeah. The marketing aspect has been a challenge for us. I'd say we're the best kept secret in Southern Indiana. We do have, like, our outpatient imaging, our volume is higher than it's ever been, and it's really word of mouth because we do such a great job. But now we have the resources of wanting to get that communication out to the teams. And, you know, with her mentioning the wage disparity, that's been some of our challenge too with transfers is staffing. And so this is gonna give us that ability to allow team members that live in this community to work in this community and stay here. So not only patients, but your own people that live in the county.
And we do have a full shared model now. So our shared leadership model is I'm the CAO of both hospitals, the CNO is over both, the chief medical officer is over both, the CFO is over both. So some of those spots were over both hospitals, but not really the CAO, not really the CMO and the CNO. Those are two really key spots in terms of moving thinking around the proficiency of the nursing staff and really the collaboration we need with the medical staff. Because it's one thing to right-size the workforce, to be knowledgeable, to take care of a patient. If you don't have physicians that are on board with keeping patients at the hospital, which is probably, I'm gonna say behind our staffing issues, I would say that we've not brought the medical staff that practices there fully up to speed. I think our ER physicians are very strong. I think our hospice program has a ways to go. So that's where I really see when we work on those things, and we shared those, you know, together as a team. I think when we work on those things, we are gonna see improvement, but I would say 35 days in, we send a notice out to all of our workforce saying that we need your resumes because we need to right-size your pay based on your skills. I think us doing that 32 days into the ownership, that speaks volumes to our commitment to this community, because that happened across the organization and it was across all job disciplines. So whether you're a food service worker or you're a nurse or you're a doctor, everybody got that same notice and those wages are gonna be considered. So that'll be a big
We're
one.
happy to have you.
Yeah. All right, thank you.
Thank you.
Appreciate it.
Thanks.
What else you got?
Something that we need to, handle before the end of the year, this will interest you. So we're starting a paramedic program beginning of next year, because we have to run these concurrents and stuff. We went through all that. Anyways, the person who is current program director is staying on through this one. She's still there in the capacity of that. However, is no longer a full-time employee of mine and is taking a job in an education position elsewhere. I need to have a new program director for next year's class, and I need to have this all done by the end of the year, because January 1st, this has to be in place. And I don't want to wait till December 6th or whatever it is, you know, to get this done and then be scrounging with COAMPS and KHAP to do that. So I'm bringing this now, that way if there is an issue, I can address it in 2 weeks. And if not, I'm 2 weeks ahead of the ballgame. It's nothing that's going to take effect until 2024, but it is a written contract that
You already have the
person
in mind, and is it the same person that's in the,
Yes, it would be a dual role.
and this is the same contract that we used previously,
It is.
so.
It's just the dollar amount is in there. It's 10,000 for 24 and 10,000 for 25. Obviously, the 25, like, yes, everything is in place. It's all said and done. The 24 budget's obviously approved. The money's already there allocated. 25, so when I initially submitted the budget for paramedic program, I did all of it at once. And then after we kind of redid the syllabus, it's going to carry over into the following year. So I split that budget in half. Half is going this year, half will go in 25. So the money will already be allocated. The money for 24 is already allocated, it's in the line item, it's approved, correct? Like, I don't wanna misspeak. So it's all there, it just needs your signatures, if you guys choose to do this.
They call it?
Yes, sir. And I have this one here, you have one, whatever you want. This one just has his signatures, cause he's not here.
That'll be fine.
But if you wanna use yours, you're more than welcome.
Use the one with his signature on it.
So you, how many do you have in the current class still there?
15, there's 10 left. So,
Yeah, so you already have people inquiring about?
18 applications, I think. That doesn't mean all 18 get in,
Oh,
but we've had 18 people apply to it.
We'll back up a second. Did we ever settle that? About the payment on some of the people?
Oh, I haven't heard anything, but never mind.
He shook his head.
This one's brought in, it's gonna be over 85 by the time we're said and done. We had a little issue as far as payment went on this year that killed our margins. This protects me from killing my margins because I respectfully spent far more than this doing it the way that we did, which I know for the situation was fine. I knew going in, everything was as expected, but I need to be able to control my margins and control my money a little bit better, and through this allows me to do that. So,
So you're asking us
to sign this. If
sign
you
a
approve it.
contract
Prospectively for 2024 and 2025. Right?
Correct,
with a new LLC?
correct.
I'm good with that one. I've actually spoke with them, so. I'll entertain a motion to sign this contract with the new LLC and the new program director, so.
I'll make that motion.
Randy makes that motion, Greg.
I'll second.
Greg seconds, I'll make that unanimous, so.
And then I will have to come back in either next meeting or in December just to get the re-up of today is the first 11 just for the program dean and the same stuff that we have to do every year. It's just gonna be
I realize the school has more benefits than monetarily, but, so don't get upset with what I'm about ready to ask. But I'd like to see like a report, just so we have it, and can make a record of it, of the return of investment in this school program.
okay. That's like fivefold though. Because you've got the training institute side. You have paramedic program, which is a complete other entity. She needs to sign this and she can have it and then I'll just get it from her.
Can I do that and just scan it to you tonight?
Yep. So you've got the training program, you got the paramedic program, which is a complete other entity. You have the CPR, ACLS, PALS, AHA stuff, which is a complete other entity. Then you have NAEMT, which is a complete other entity. And then you have all the money that we save that we don't bring in monetarily, that I'm not sending 46 employees to that we would normally have to pay for their education. So I can get you the reports that I have.
It's not so I can judge whether or not
feel free
to keep it. I just think it's important for us to do it on video to let the people of the county understand
and just for
at what level we're at and how we do things.
Yeah, and for your peace of mind, the training institute is up here, which is the training part side. Paramedic program is on the bottom left here. This year's the 37, the almost 80 is overall. That's how that's broke down. Into this training income will be our EMT and advanced EMT classes, AHA, and our EMT. But to this figure, you're gonna have to add almost about probably 30 grand of savings that we're taking as a service for our employees. Because we're looking at, our paramedics are $1,200 every cycle, and then our EMTs are about $600 every cycle, for all the just for the certification stuff
So
that we're not sending to Zach's Training Institute to pay
Right,
them.
so, I mean, when you do that report, I would add that number into,
I'll make you one.
what we are making.
Okay.
Well, I mean,
Add that in, you know.
when this thing first started years ago, it was, I asked the question, what are you gonna do when everybody's a paramedic?
Love
You
it.
know, hey, well, I understand that, but how do you gonna pay them? Because everybody's gonna want paramedic pay, which I understand that. So, that's I guess,
It's a double-edged sword
it's,
because.
that's a bad thing to happen, I guess, but that you have trained individuals to a level that nobody else has.
Right, and I mean, when you're looking that the state is, I think it's up to like 1,200 paramedics, it's over like, that's right at $4,000 per provider, like all levels, but 1,200 paramedics short. And after this program ends, I have the potential to have 12 paramedics for, 9 trucks.
And so, how many of those are county employees?
In my class,
Yeah.
4 full-time employees I think are in there, and there's 11 left, so.
So we're gonna have 4 new paramedics in Scott County that were advanced EMTs.
Or basic EMTs.
Basic.
I mean, and it's one of those things that, from a coverage standpoint, like, right now, if I have a paramedic take off, then we're not running a paramedic truck. Having, 1 extra on a shift is nice, because you can shift them over and we still have this, we're not I don't say neglecting, we're not hindering the coverage that we potentially have. So, if we come to a day that I have 18 full-time employees and I have 18 paramedics, we might have to revisit that. We have a couple extra, I'm just
Yeah, I get that.
gonna
And
sit here
that's a positive.
and ask everybody to deal with it, because, we have attrition in our, in our field that, we Jennifer's office knows we cycle employees like they're socks, so, just because I have them now, at the beginning of the year, I might have 18 paramedics, doesn't mean I'm finishing with 18, so.
I had a comment, but I'll keep it to myself.
I changed my thoughts.
So, a while back ago, and I apologize that I don't know this answer. There's a reason why I don't know, but, you came to us and you wanted to, increase the benefit package for some employees. And I believe, if I remember right, we voted to let them do that. And then you took that to the council, and what happened there?
With the
Council, what did you?
Kind of your matrix type of thing you did with that.
I don't have a matrix, I just have, like, I don't get, my department doesn't get longevity, but we don't have a matrix either, we just have levels of care that get paid differently, obviously. We increased I came here asking for the PTO request. And I think we settled, like, we compromised in the middle of there, for an hour for monetary value. And then the holiday ended up, I think, finally getting approved after, like, cause there's no pay difference in the holiday. Whether they get an extra hour or I'm paying people to cover, or paying them, because it used to be given in days off. And the problem with the days off was they had to burn them or they lost them. And most people didn't, I don't have coverage to give them days off, so they kind of had to lose them. I think that ended up, I know that ended up finally getting approved after a couple meetings. I just had to show mathematically that, there was the potential for like a $2,000 difference on the year. So, and not taking longevity or not having longevity, I mean, saves quite a bit of money.
So we have everybody at the EMS right now, are they happy with? I mean, for the most part.
Yeah, I mean, I think they're happy.
I mean, nobody's gonna be happy every day at work.
No, respectfully, I think that, I think the council did a decent job for sure this year, especially, I will say they did an amazing job over some years past about including department heads, at least in the conversation. I think with the way the economy is, they're gonna want more pay. I'm still having an issue making my own money and not having control of my own money. I'm still settling into that 2 years later. I wish that I would be able to articulate if I got $1 million in the bank and I'm bringing in 2.5 million a year, I should be able to have the budget that supports it. But beyond that, you know, I would have liked to give them a little more, but I understand that, you know, we have to do stuff systemically. But my only issue is if we're gonna treat my department differently, I should be able to act differently, but other than that, I'm okay.
Thank you.
That's fair.
I mean,
You're ahead right now, so
I'm done. But, I mean, listen,
I get it.
I don't wanna get on a soapbox here. I was asked to do something over a, you know, a 3 to 5 year span of getting this place dug out of a huge hole that we're in. And the dollar amount that we wanted to be at after 3 to 5 years were surpassed.
You're already there.
I
guess with that, I'm gonna.
But, you know, at some point, we've got to start acknowledging the work and the progress that's been done, and I'm not saying people aren't appreciative, but, you know.
In your budget hearings, did anything come up about the last striker payment?
No, sir. My idea was that I'm gonna end up eating that, going back for an additional appropriation.
we're at the last payment.
This is the last one.
What is it,
$154,746.23. Yep.
Okay.
I'm not gonna write that number down, cause you're gonna come back with it.
I'll have a piece of paper. One thing that I know that you have.
When is that due, so that?
March. So it's gonna end up me coming back for an additional appropriation.
Which I don't know that we paid the current fiscal year's payment until
May, and we had some hefty fees that I think we ended up getting taken care of, but they were not happy, so that's a process that I'll be starting fairly early in the year.
Yeah, I wasn't happy with that one.
I mean, we're like hefty, like more than I make in a month fees. So they weren't little. But my truck that we signed a loan for is in my budget. I put another truck in my budget to purchase another one, which I think I'm actually gonna go a different route, which I need to talk to you guys about eventually. I don't think I'm gonna purchase another truck next year. I think I'm just gonna purchase, motors and transmissions for the 2 vans and keep what I've got and rotate those if that's something you guys are okay with. That way I don't have to worry about another loan the year after.
We can extend the life.
So, I mean,
It's a smart decision.
I'm getting, I'd like to have one more Type 1 in my fleet, but I'm not trying to be greedy right now, so I think taking the money that would be a yearly payment and just dumping it in the motors and transitions and getting another year or 2 out of them is more fiscally responsible than buying another truck right now.
Yeah.
So,
I'd agree.
Yeah,
that's where we're at.
thank you both.
Last night go okay? No issues out there with anybody?
Here?
Yeah.
Cold.
Yeah.
But no,
Yeah,
it
it's
went well. We're in high acuity season for us, so her and I are running a lot more. And that's, you know, everybody's trying to burn their vacation at the end of the year, or take holidays off, and I will say that, there's shifts that we're running single medic, so her and I are covering a lot more. Just, that's something that we're required to do with the certification that we have, but that's where we're at.
Alright,
Okay, thanks, Mike.
appreciate it. Thank you both.
Thank you, Nick.
Alright, recorder, Cheryl Grant, signed redaction services support contract.
She brought this, she has had this to us before. She came to me again, I'd forgotten about it. We had tabled this before. This is the service contract she needs to keep her support going on her.
Is it computer?
I think it is. And she said it's something we do every year, and it comes out of her perpetuation fund, so it's not out of
So
it.
she has the money.
She has the money to do that.
Is there an increase in it, or is it?
I didn't ask that. I don't know, I didn't ask that.
Zach, you wanna look at that, or have you?
I think I have looked at it, previously. Yeah, I mean, I think it's we're required to do certain things, and they just offer basically it's not a price per page.
Does this kind of alleviate the mimics or whatever that paper was?
I think to a certain degree, it kind of does assist in transferring from like paper to digital with the required redactions and things. So, I mean, I think it's, we've had the service. I didn't see any issue. I mean, I don't know. I don't have any basis to say that it's totally out of proportion with what it was previously, or it's out of proportion with the, the market rates or anything.
Okay, question.
I don't see any issue with the contract itself.
Not ready, some red flags.
I'll entertain a motion to renew, the redaction services and support agreement. It's between CSI Computer Systems Incorporated for the Recorder's Office, so.
I'll make that motion.
Randy makes that motion, Greg.
I'll say.
Greg seconds that, and I'll make that unanimous, so. Get that away. Moving along, area plan, and I'm gonna say this is our city appointment, to the city's area plan board. Has anybody got a person that we would want to fill that position, for the city? And, the guidelines are they have to live within a mile from the city limits. They can live outside the city, but they have to live within that mile, is what I'm being told. Greg, you got somebody?
I'd like to nominate Brad Stotts for that position.
Randy, you got any comment on that?
Who did you say?
Brad Stotts.
Brad Stotts? I had somebody approach me wanting, Michelle Watts.
Yeah, but that was for the county,
Oh, that's right. You're right.
cause I got the same
Yeah,
information.
you're right. No, I don't have anybody.
I'll entertain a motion. Well, Greg's made a nomination of Brad Stotts to fill the city's area plan position, so, do I have a second?
I'll second it.
Randy seconds that, and I guess I'll make that unanimous, so we'll reach out to him and have him at their next meeting, so. So now, to the county BZA position, we had a person that resigned off that, actually Greg Gibson. I want to personally thank Greg for his years of service on that board, and sometimes you don't do anything, and sometimes, you catch a lot of grief, and I think Greg, being a business person in town, he didn't feel like it's probably good for his business to be on that board and making some controversial type of decisions. So I appreciate his years of service, and I guess now that we're talking about the county BZA, do you have a nomination that you would like to put in?
Yeah, I guess Michelle Watts.
Okay. I think, isn't Michelle working she works at the library, doesn't she? Okay, well, Greg, you got any comments, or?
I would second that.
Okay, so, Randy's nominated Michelle Watts to fill the county's BZA position. Greg's seconding that, and I'll make that unanimous, so we have both boards, fully staffed for our people, so. Moving along. Actually, can somebody reach out to her and you talk to her, Marty?
Oh, fine.
Can you talk to her? Okay. I asked them to put Minix Drive on the agenda tonight for one reason, and I've had 2 or 3 landowners out there approach me and ask if we would take their road into the county. They weren't asking to have it paved or anything, they just wanted, some rock put on it in the road every once in a while. It's came to our attention through some work from Marty in the area plan that there was a resolution, I should say, it's a legal action.
It's actually an agreement that was entered into by the Scott County Area Plan Commission, the county commissioners, Chris McGee individually, and Land Realty Inc., the landowner and developer. And it was entered into as part of what seems to be an intent to eliminate any uncertainty in the cost of protracted litigation between the parties involving numerous rural land developments in Scott County. And specifically, there's a outline of written commitments that deal with what the parties all agreed to. It was signed by all the parties, agreed to, and then filed with the recorder. And it's, I would say specifically, that the parcels described in Exhibit A, it says, the parties agree that the following written commitments apply to all land described in Exhibit A must be incorporated into all documents transferring title from the developer, that the parcel is serviced by a privately shared roadway and is not a county road. That it's the sole responsibility and sole liability for the construction and maintenance of the roadway belongs to the developer and purchaser. The terms conditioning governing the maintenance of the private roadway shall be described in a homeowners association agreement between developers and purchasers. Terms governing the maintenance of the private roadway by the homeowners association shall be provided to area plan and as a prerequisite for the issuance of improvement location permits. I assume that they did provide those rules. We're not responsible for the county is not responsible for snow removal and assumes no liability in regard thereto. The county makes no commitments or assurances to purchaser in regard to the availability of utilities, mail pickup or delivery, garbage removal services, and school bus routes. Again, these written commitments run with the land. They're binding upon the purchasers and purchase successors and interests, assignees, personal reps, heirs, and all subsequent purchasers of this parcel of real property. So there was a written signed agreement that said that it is not a county road, and that's already been litigated, decided, and they've assumed that homeowners association essentially assumed the responsibility of maintaining that roadway. So I would say we have no authority to accept that road.
Okay, well,
This is very different from previous circumstances where there was a deeded dedication of a roadway as a public thoroughfare upon, I think it was a certain percentage of homes being built, okay? Totally different set of circumstances wherein these commitments should have been, don't know if they were, but should have been, subsequent purchasers should have been made aware of that circumstance.
okay. Well, Marty has sent me that copy of that stuff, and I'm gonna email that to the 2 or 3 people that have been asking me, so we'll move on with that. So, violation of trash collection sites in Scott County.
I have had a few conversations with Mr. Pittman, which is the IDEM, I guess, inspector that comes around this area. And we have the luxury of him living in our area that he passes on 256 and passes right past, one of the sites, and every time he does, we've had people throwing their bags out there prior to the 3 o'clock, timetable that they're supposed to throw them down there. So I know, I don't know if it's your district or yours, so it's Randy's district. I got a hold of Andrew, and the city of Scottsburg has placed 2 poles out there, and Andrew has 2 new cameras that he's placing out there that will read somebody's driver or their license plate on their car and take a picture of them.
And just so, I mean, I think everybody understands, I mean, you know, these particular issues have come up multiple times in the last couple of years. And there were some discussions of how to resolve a number of different disputes that I don't think necessarily dealt directly with this specific location.
Yeah.
But it was kind of looking at this whole, you know, process as a whole, I think. You know, we reached kind of some compromise decisions with the county council on those things, but we will get fined
up to $25,000.
And those fines will effectively, everyone who showed up and was very in support of keeping these programs running and things like that, the sites open, understand that, you know, one bad apple can spoil the bunch here, and the county will not be able to absorb the costs of those increasing fines, and we may have to look at closing a site if people don't, you know, honor the rules.
Yeah. Well, I just want to make sure that people understand that if you throw a bag on the ground prior to the 3 o'clock time period, you can be fined up to $1,000. And I don't want to do that. I know I don't think either one of these guys want to do that, but I'm not gonna.
Is that posted out there?
Yes, it is. I took a picture and put it on Facebook along with the guy's citation that he wrote. And it's not the first time. I mean, it's multiple times.
He's been patient with us.
He's been very patient. I'm not being a jerk about him driving past here. I mean, we shouldn't be doing what we're doing, and we're not doing it. We have people that either decide, hey, I'm gonna throw that trash bag in my car on the way into work and just throw it out there because I don't wanna do it when I get off work. That's not the answer. I mean, if that's the case, then spend $60 for a quarter and have Rumpke come pick the trash up at your house, because we're not gonna incur up to a $25,000 fine. And quite honestly, in one of the comments he made is that we have to go out there and dig up 6 inches of dirt and haul it off like hazmat. I mean, that's going to be costly. But you know, you're not thinking of that when you throw it out there and go, well, I'm going on to work and, you know, I threw my trash out and I don't have to worry about it. Hopefully, with the new cameras being put up and they're supposed to be put up today, and if they're not, they'll be up by the end of the week. Someone will be receiving a fine in the mail, I guess, and have to come in here and pay a fine, and we're gonna have to look them in the face and go, it's not my fault. You know, it's not your fault. It's not your fault. You can't read the sign that says 3 o'clock to 7 or whatever the end date is, or the end time. And it's not the first time that we have went to the paper and had something put in the paper saying, don't do this. We've been on Facebook, don't do this. And I know we have had issues at another family. We had some issues. I think they cleaned their act up. We've had issues in Lexington, you know, not so many, but, and I will give Troy Ponder kudos, he's got his own camera out there and he lives down the road and he'll call the person. I've watched you on my camera, go back and pick your trash up, you know, but we don't have that luxury out there, and I did have some people comment on my Facebook post and says, how do you know they're even from Scott County? Well, I don't, but I'm not gonna go out there and dig through somebody's trash, but if it's out there again, I might go out there, cause the last time, I won't say the last time, 2 years ago when I did this, I went out there and tore through some people's trash and there was a Papa John's pizza box with their name and address and everything on it. I mean, you know, I guess maybe you need to understand that, you know, somebody will dig through your trash and find your name. So my whole thing here, I think we have, and I'm saying we as the commissioners have went above and beyond trying to save this location or all three of the locations for the convenience of elderly people and some other people that drive past there and go, you know what, I'm gonna throw my trash out there, I pay county taxes and whatever. But we find out that somebody is coming in from Jefferson County or Jennings County or wherever and dropping their trash, and I don't know why they drive all this way over here to drop the trash. But we'll go after them, you know, so.
I just wanna add to that real quick. To be honest with you, we have personally battled to keep trash service in Scott County. Against a pretty good opposing force, actually. And I want that out there. I mean, because we have. You know, I hate to, you always hate to toot your own horn, you know, and that's not what I'm trying to do, but I mean, it's a fact. We have, and this is just something more that we don't need to try to deal with on a daily basis. I mean, it's a service that most counties don't offer.
No.
We're trying to keep a service going. You know,
very unique.
we don't need people fighting us on it. I mean, if you enjoy the service, if you know somebody's doing it, pick up the phone and call, because you'll lose it.
Yeah. And
we just don't have the money to do that.
that location has the attention of IDIM now. I mean, so
Yeah,
that is on his, that's a routine inspection for Mr. Pittman now.
Yeah.
And so I know you guys talked to him. I don't have his number programmed, but I know, he calls enough that I know who's calling when I see that number pop up. So we're gonna try to fix it, and we'll do everything we can to keep it. And Randy's absolutely right. I mean, you know, we're doing all we can to try to, you know, keep these sites open, but we need the public's help.
Yeah.
And doing their part to keep it open. So.
Well, I want to back up and say that I'm not talking negative about Mr. Pittman, because.
Not at all. He's been very helpful.
He's been very
patient, very helpful.
Very patient, I'll say that, and he's been very nice when he's talking on the phone with me, and I know Jennifer spent time with him, he's came in here.
He's been very helpful in getting the transfer station around.
But I'm just saying that
he certainly hasn't done what he could have done.
Oh, he could have done that the first time.
Been very lenient.
Yeah, he has.
And I just want to thank him, I guess, as one of the commissioners, and I'd like people to understand, you need to stop. And if you see, you know, I know, years ago we asked if the sheriff could put a reserve deputy out there, you know, and just sit there, but we don't have that. I don't think we can do that, so. But I mean, even talking with Todd, I mean, Todd's like, I can't put her out there all the time doing that, but maybe we could put her out there one day and say, you know what, have her sit out there one day and maybe she can just talk to people and say, you know, I can't do this, but hopefully the cameras gonna, create I'm sure we're gonna have a firestorm when somebody gets a fine, and I know what some of the reasoning by those satellite locations are, is that people they tried to keep people from throwing trash out on the road and, you know, their bags of trash and everything else, which you're always gonna have people do that, but I don't wanna see, you know, our roads getting trashed on the road because somebody can't throw it at 3 o'clock or after, so. But anyway, so that was just an update, and what I'll say, hopefully by the end of the week, I know Andrew tried to call me today and I didn't get back with him, and I told him I'd call him tomorrow, but I know the polls are up, thanks to the city of Scottsburg and, for going out and doing that, so moving on. Consideration of the 2024 holiday schedule, so has everybody had an opportunity to look at that again and come up with a solution?
I went ahead and made one that mirrored the states. It kind of ours from last year in the state too.
Well, yeah.
The only thing that I could see was the one, maybe that's weird, that it is the states, was the February 19th date. Maybe this was intentional, but, so that's a Monday.
On the states?
Well, on the one, this is February 20th for President's Day, President's Day is the 19th, which is the Monday. I don't know if the state.
Oh, the date's wrong?
And you know what, actually, that's one that was taken from last year. They had Martin Luther King Day, sorry.
Who did? Oh, you went off the states?
Yeah, I went off the state and last year's, and then the one that the courts are using, they're doing President's Day, and you're right, it is the 19th.
Yep.
So I need to change that one.
Washington Day. Washington Day, Veterans Day, Thanksgiving, 2 days, and Christmas 2 days.
Now in the state, they call that like, you get Thanksgiving Day, and then it's like Lincoln's birthday or something like that.
They've got Washington and Lincoln's birthdays. So what's your pleasure, gentlemen? And you went way back. See whose names at the bottom though? Yeah.
Oh, and I thought I had changed that, so somehow, yeah, that came from 2017, actually, is when I found in there.
So, what's your thoughts on, you know, holidays matching, closer matching with the court dates are?
Where that's at. Well, they do, except for a couple of them, don't they?
Yeah.
Matching what?
Do you need copies of this?
One of those, I'm gonna tell you, I would never approve of one of those.
I know.
And I should have said that.
Well, no, I
You
know.
don't have to, if you're talking about the judges, we do not have to really act on that at all. The courts can close separately on days if we did, so I think we mirror those in many respects, but they have like some additional days on there, but we don't have to mirror those dates. I think the judges just wanted you all, just in case we wanted to.
Well, then
consider.
most of them are, I mean, we're good with most of them except 2.
Okay, so my opinion on this and what I'm going to suggest is that we follow Judge Mount's schedule the holidays. Not because I necessarily agree with it, but I think it does cause animosity within the departments. And while they did get a 5% raise this year, the cost of living has really raised a lot more than that. And anything we can do to try to, I mean, something as little as this, to try to keep people happier in their roles here, I'm for it.
Well, I appreciate what you're saying, but, you know, it looks like the judges have 15 days, the state has 14, and we have 12. So, if you're, and I get what you're saying,
But there's federal holidays too. There,
do what?
the judge is following federal holidays.
I mean, that's fine, but we've never done that in the past, and the state doesn't even,
Recognize one of them, yeah.
yeah, so. Greg, what's your thoughts?
I agree with what Randy's saying also. But I'm not, so the judge has 15, the state has 14.
We have 14 too.
You're right, cause I didn't count the 2 days.
Yeah, don't count by lines, yeah.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. We have 14 as well, it's just like the state. The judges have 15.
They just have one extra, the courts have one extra day, right?
They have Christmas Eve and Christmas Day, and so do we. They have Thanksgiving 2 days, and then they have, roughly what we have, but they added one or 2. They added 1.
So the judge has 16.
Is that what it was?
Yeah.
Yeah, that's what I'm trying to,
So yes, 2
that,
more.
because there's one line for Thanksgiving, Thursday, Friday,
So yes, correct, I didn't count.
but he didn't,
Yeah, he did.
but Christmas Eve and Christmas Day was
Yeah.
separate,
So
unlike
yes.
ours where it's,
So yes,
Yeah,
16,
okay.
we have 14, then the state has 14.
Well, I make a motion to follow the judges.
Alright.
I would make a motion to add, maybe split the difference and add one that we don't have instead of.
Well, every year, we don't take off election day when there's not a county election, is there?
no,
Yeah,
we do. Yeah.
yeah,
So we take off for a city election even though,
yeah.
Not every county does, but we have in the past.
So does the state.
Yeah. I will be in a county that is working on municipal election, but
so. I'll entertain a motion, whatever one you guys are talking about.
So I've got a motion out there now.
Alright, so Randy's motion is to accept what the judges, I guess their holiday schedule for 2024, which is 16 days, 2 more than what we have now.
I guess to me, it's a little thing to get. I don't think, most people expect during holidays that places are closed. I mean, it's.
So your motion is to accept the
Judges.
judges'
Exactly.
2024 schedule?
Yeah.
So there's a motion on the table for, to accept the, judges' 2024 holiday schedule, Greg?
I'll second that.
Alright, Greg seconds that, and I'm going to vote no. So I guess we'll take the judge's, schedule for 2024 then. Which gives county employees 2 more days. That's actually 7, I'll put it that way, that was the states. But yes, yes.
Jeffrey, you have to do this.
Yes, I did.
Yeah, that's perfect. Alright, moving on. Consideration of the regular special invoices.
Here's a special invoice for Bridge 105.
Already?
Well, and, maybe you wanna look at how they can pay, because I guess those are big enough, they were hoping they wouldn't have to wait very long on them, maybe. I mean, this one, it came in this week, it'll be special approved to be printed Friday, but they would like to keep it where they can get it within a week or something if they can. So if there's anything special we can do, maybe talk to Zach.
So you're saying that the contractor is asking to be paid every week or every?
No, I don't think it's every week, but whenever he does, he would like to get his pay within a week or so instead of waiting 2 weeks or a month.
I
mean, I'm sitting here thinking, really,
I want
the special invoice,
I think
the most
that-
they should ever wait would be at 3 weeks, I think, when,
Yeah, but I mean,
Okay, here,
I thought we paid, I didn't know we paid him in
Increments.
increments. I thought we paid them when they were done.
I think there'd be draws throughout the,
I don't know. I mean, that'd be the Kevin
I
question.
think, actually, I think we need to have Zach, because
So was that for, who's that for?
That's
we have a contract. And I want, I'd love to help Kevin out, but we have a contract.
Yeah, that's why I said I've never, we built bridges before and never had somebody come in and say, hey, I want to draw before it's done. When it's done, he gets paid.
I mean, because technically thinking, so we have it in the agreement that we're gonna have the bridge done in 120 days. Well, if you're making draws and you don't have the bridge done in 120 days, what have you?
That question.
Well, at the state level, we have contracts and they invoice on the contracts.
They do?
Mhm.
We have a special invoice from Bridge 105, the one we have.
I'd like you to look that up.
And I guess he's asking, he's going to draw on some money.
You can see,
Personally, I've never
on that before.
seen that before.
Okay, well, that's new to me, so, I don't know, that's all new to me.
He just finished Getty, he never asked for a draw with Getty, he just finished, he finished one a couple of years ago out on, Plymouth Road, he didn't ask for a draw there.
Yeah, but this is $1 million bridge.
I get that.
And
I don't know what the contract read that it's stated whether he got draws.
I mean, I ain't saying that I'm necessarily against it. I just want to protect us first before. I want to see what our contract says and what.
I just never have seen that happen before, and then yes, it is $1.5 million bridge.
I mean, have we ever done $1 million bridge in Scott County?
Oh, I'm sure we have. Twice, probably.
I'd say with inflation, we probably have.
No, maybe not. I mean, there's been some, to me, that's the biggest one I've ever seen.
I mean, the old bridge came in at $1. That's what Lloyd Brown.
Is this in anticipation of?
I've never, to my knowledge, we've never paid a contractor on a bridge prior to that completion of that bridge. But that's why I'm asking was something in his contract that said he gets draws.
I don't know, I don't have the contract.
I think we need to table that
Okay.
and give you time to look it over.
I'd rather, I mean, I'm not saying, I'm like Randy, I'm not against paying him. I'm just saying that I've never seen that ever happen before, and I understand what you're saying.
Yeah, we do.
I mean,
Yeah, all businesses invoice throughout the contract.
Yeah, I mean, I have a contract, but I invoice.
So how much is it? I need to see what that amount was.
$101,698.88.
Well, again, this is coming out of the ARPA money, and do we have to, how's that gonna happen?
No, we've already done,
We already did the,
that's all done.
ordinance and everything. So, I mean, he has a line item, so it just comes off the line item. I don't know, I don't care to do it, but I just never have seen it before.
I don't care to do it either, I think we better check our contract. I feel better if you checked our contract.
That, I don't have any object, I mean, I don't have the contract.
Right.
I've never had the contract, let me make that clear, but I don't keep the originals when those are signed. So I'm perfectly happy to go back and look at what's in there.
I mean, I guess here's where I'm sitting really right now, I just said it. Kevin has been dealing with Kevin. Kevin Hall's been dealing with Kevin Brown on this. Kevin Hall hasn't brought this to us and asked us to do this. So without knowing how Kevin Hall feels, I do not want to make a decision.
Kevin signed it.
They're the ones that voted in, yeah.
He all know the contract.
Yeah, Kevin signed it, so he knows about it. I'll make a motion to pay it, and then we can check and see what it is, but I'll entertain a motion to pay the invoice for KLB excavating, for Bridge 105 in the amount of $101,698.88, and it is for demolition, mobilization, clearing of the right of way, removal of existing structure, and installation of the HP pilings. So
I'll make that motion, because Kevin did give us a really good price on this.
Randy made the motion. Greg?
I'll second.
Greg seconds that. I'll make that unanimous. So moving along.
Sorry, I didn't see
Is
Kevin
there
sign that.
is there other invoices?
Yeah, they're right here.
So has everybody had an opportunity to look at the invoices from Mandy?
Yes.
I'll entertain a motion to, actually, there's 3 spaces there, so. I'll entertain a motion to pay the regular claims.
Make a motion.
Randy makes a motion, Greg.
I'll second.
Greg seconds that, and I'll make that unanimous, so. Still moving along. Consideration of the payroll for October the 20th, 2023. Has everybody had an opportunity to sign that? Everybody had an opportunity to look at the payroll. I'll entertain a motion to accept it.
So they want vacation time and their money earned?
Amazing, isn't it?
I'll make a motion. Oh, yeah, that's right.
Oh, and there's also an FMLA request and they're up about that.
While we're doing, you said there is an FMLA?
Yes, there is, I forgot about that.
So I entertain a motion to pay the payroll.
I made a motion.
Okay. Randy made a motion, or Greg?
I'll second.
I'll make that unanimous. I'll let you look at it. No, I think he did, didn't he? Nope, he didn't. passed it without signing.
Attorney, you have anything?
The only thing is I have, submitted an additional invoice for the month of October. Because it was, I would say, an extremely busy month in comparison to normal months, so we'll deal with that at a later date. I just wanted to let y'all know that was submitted.
Are you ready to set up a executive session for?
We can do that if you want to pick a day next week. I would just say I'll do the notices with the specific exception that applies. I would just say if you all just want to decide what date and time you want to use. I cannot do Tuesday because I'm working.
What's good for you?
Yeah, I mean, that should be good, yes,
What's good for you, Randy?
Yeah.
What's good for me?
For an executive session,
I'll do whatever you guys need, I'll be here.
let's do it Wednesday, you good at 5?
I'm good at 5.
Alright, I'll entertain a motion to approve this request for leave.
Make a motion.
Randy makes a motion to accept the FMLA, Greg.
I'll second.
Greg seconds, and I'll make that unanimous. Alright, I've already asked the attorney, you guys got anything? Randy?
Yeah, I do have some. So what would we have to do, rethinking about this thing with Ben Petty? What would we have to do to take the Ford Maverick that we have under the building maintenance and giving that to Ben and taking Ben's SUV and swap them out? Because I don't think Eric is really utilizing that Maverick all that much, and when he does, it's right here and now. The vehicle's only got 102,000 miles on it, I think is what Ben said, and he just put $1,200 worth of tires on it.
Well, here's, and I don't know much about the Maverick, outside of it's a cheap little pickup truck.
It is, but it's...
But I guess where I'm gonna go with that is a four-wheel drive. Because some of the places Ben's going in.
The vehicle he had selected was a four-wheel drive.
Huh?
I don't think the vehicle he had selected was four-wheel drive.
Okay, because I don't even remember how to do anything with
It doesn't say it is.
It is, it's a four-wheel drive.
Where does it say that?
F-150.
It's the letter on the front.
Yeah, it says Ford. Right at the rear, dear commissioners, attached is a 2023 F-150 4x4 10-speed right here.
Oh, on the front page. It wasn't on this. Okay.
I'm concerned that where he goes with some of those construction sites that he may not be able to get in, get out. Good idea. Not saying
I
that-
still don't know that. When we're talking $50,000. How many construction sites are we, you know, I'm getting at, how many construction sites are we talking about here? Because most people doing a construction site is gonna have a drive of some sort because they've gotta get materials back and forth to that construction site.
I'm just gonna say that, to my knowledge, I don't know that they ever had a vehicle, the inspector ever had a vehicle, so I think Lee always drove his own vehicle.
Well, the other one had a two-wheel drive Ranger.
But where I'm going at with it is that if we buy a vehicle for him and it's obvious that he's budgeted for it, we buy it for him, when I'm dead and gone, it's probably gonna be the same vehicle. Cause, you know, it's not gonna be replaced with something, I don't believe, so. I don't know, like, I understand what you're saying, but, we can talk about it, cause we can talk about it later, or bring it up again. Look at it and see what we can do.
Yeah, I think we need to talk to him.
You can look at the other quotes as well, I mean, we don't know what's
Yeah.
gonna come back.
But I'd like to talk to him and see if that would suffice with him.
Okay.
If you guys are open to that.
Well, I'm open to saving money, but I don't know that that's the vehicle that will work. Cause I mean, that's a little,
It would save fuel.
that's a little truck.
It would definitely save his fuel costs too, fuel budget, because it's electric, we already have it.
Yeah. What else you got?
That's it. I'll shut up.
Oh, yeah, shut up.
No, I won't shut up. I want to shut up.
I don't have any.
Okay, let's see what I got here. I did ask about the striker payment, and I was really hoping that the county council would have put that last striker payment on a budget someplace, and so that we don't come into March and go, all right, there's the money.
It would have been a good idea. I will say that, again, we had an issue this past year that did not happen, and it was a problem.
Yeah.
We worked through it, but I don't know that they'll be willing to do that again. So.
Well, and I'm not trying to create an issue with the council, but when we have expenditures that are legally bounding to pay for things, then we need to know where the money's gonna come from, so. And I don't think it's us three here that's gonna say, well, take it out of this account, cause I don't know those accounts, it's not our job to know where there's $155 or $154,800, whatever, and some cents. But I wish they would have put it someplace, so. I don't think I have anything either, so.
I do, actually.
You said you were gonna shut up.
I did. I did. I talked to Ben Petty, before the meeting. And I asked him if he would feel comfortable, now that we have a Facebook page, to,
No, go ahead, I'm sorry.
any kind of work that we're gonna be doing, that we're gonna be subbing out contractors, if he would feel comfortable writing work scopes for any of that stuff for us. And he said he would feel comfortable doing that. He's never done it, but he said I know Ben knows what to do, so I can work with him and we can do that. If you guys are all right with us putting this on Facebook as a way of reaching out to other contractors in our county that wants to do business with the county.
I think we talked about that once.
We have, but that was before Greg was.
Yeah, I mean, in my mind, you just need to have a page for that, doing business with Scott County, and have all the criteria on that page.
Maybe we can just put it on our Facebook.
Well, it can be on both. You can put it on Facebook, but you can also put it out there.
Oh, you're saying on our website?
On the website.
Oh, okay. I thought you were saying another Facebook page.
Oh, no.
I do have one other thing. The applications for her job,
They're in there,
Can we have them?
yes.
Cause I wanna actually talk about it so that we all three know who has applied, and then we need to, how many is there?
I don't know, 2 or 3.
Okay.
I think that we can do that in the same executive session. I'll just add that exception to
Okay.
the posting.
Okay, but we just need
Do
to,
you want those now?
If there's-
I can go make
No,
copies here. now.
let's wait till Wednesday, but, I'll put that.
if there's 3, then,
I think
you
there's
know, we'll
3.
probably interview all 3, and we won't have, I mean, I don't, if there was 12, I'd say everybody
I think
picks
there's only 3
3,
at the
and
moment.
we go from there, but we'll just do it in the executive, so.
I've got one thing to bring up real quick.
Oh, you said you were
I
done?
know.
What a bad example.
Sorry, but just for you guys to maybe just, start thinking about it, cause I've had, Billy Coleman reached out to me the other day and was, and I've talked to Mayor Hawkins about this too, and we kind of talked about it in some level in here, but, talking about the drainage issues and, with the drainage board, maybe getting their help and direction, and they're looking for help from us and trying to figure out, you know, how we can assist with all of that draining from around the railroad tracks on down to the center, and, you know, keeping that flow open and moving. So that's, I know that's something that I advised the mayor, when I met with him to get with the railroad. So that's probably another meeting that we'll probably have to have with them, just to talk about kind of if they've had an opportunity to do that. I don't know, maybe, I was thinking about reaching out to, Terry Gooden to see if there was any opportunity for funding, to help with that also. But, you know, it's something they feel like that would, you know, help them considerably to have that ditched out through there and cleared, so.
Well, I did have a meeting today with, I had a meeting today, and Tyler from the governor's office was there, and we talked about the USDA a little bit, and he said they have all sorts of money, you know, so maybe that is an avenue that we can reach out, but I did, whether we get it or not, I did put a application in, or I guess a bid request in to the area, or not, to RDA for the
Ready 2.0.
Ready to, you know, with the $81 million I asked for $2 million for the drainage board to clean out Stucker Ditch. So maybe, you know, maybe we get a bite there or something. Brought up something minute ago, now I've lost my train of thought, because there was something else I was gonna bring up, but I'll just let it go, but I can't remember what it was.
You know, the one thing about just the area that they're talking about through there, I mean, you know, obviously you're close, you're within probably 25 feet of the tracks or so, you know, there has to be a lot of coordination with the railroad.
Yeah.
You know, you'll have to have flagging, there's a lot that goes on. We just can't, or anybody just can't go out there and just start ditching where that is, near the track. So, anyway, there's a lot of work there and coordination that has to take place to get that work done, but, that obviously is expensive, and so we would certainly need some help, maybe, obviously from USDA if they can come and step up, but just, I know the drainage board is also, that's a big concern for them as well, so let's think about that and try to help that area if we can.
Also, I know they did came in here and did a presentation, but I'd like to, I want you guys to think about, bringing the museum back into the county property. And I know they have a $300,000 debt out there on the remodel. I don't know how, I mean, there was some, interest, I guess, from the council to do that. But I did reach out to Terry on that, and I don't think that the USDA is gonna, flex any on on the loan itself, so. But it might be something that we can help pay off over, 3 or 4 years, and right now, all they're trying to do is pay the interest. And they've been doing that for several years, so.
Yeah, it's time to get something done, so.
I think if we bring it back in, that's an asset to us and, property that we can help utilize, and quite honestly, I'm a little impartial. I think Sky County history is down there, and I'd encourage schools to walk their kids through there, so.
Well,
But we wouldn't be running it, I mean, we just.
Right.
It'd be our property again.
right, but I think, not to get all nostalgic here, but I kinda think we owe it to the future generations, of people in Scott County to secure that history museum.
Well, I agree with you wholeheartedly, and again, the Preservation Alliance would still run it like they do today, just, we would take some of that burden off of them as far as the finances of it. I mean, right off the bat, even if we didn't touch the 300,000, we could put it on our insurance, we could do some of that, and
What's the old saying, how do you know where you're going if you don't know where you've been?
well, yeah. So anyway, think about that, we need to do something because, one of those members down there, not saying they're dying off, but there's not a young breed of people down there that's keeping it going, so. So when Marty retires here, she's gonna go down there and be the big drum beater. All right, I'll entertain a motion. Wait a minute, Jennifer, you got anything?
No, I think I'm good.
Let me back up a second. Jennifer had a request from now a former employee. And it has to do with the retirement.
Yes.
And, when we had, and Zach, you were involved in this, when the State Board of Accounts was in here and I'm gonna be frank, the sheriff's office was saying that their retirement wasn't calculated correctly. We asked the State Board of Accounts if they could come in and go through that and make sure it's all right. Well, they didn't do it. And I know the lady that was here, the lady was here sending an email to her boss asking that question. I think you were even copied on it. So we just need to move that, and I don't know what it's gonna cost. And actually, the girl that was here said she thought it was gonna be less than $1,000 to do it. But we need to do that, so all the employees, whether they're here or there or anywhere else, feels like they didn't get railroaded out of some money for their retirement or whatever, so, we're still in session here, so I'm gonna ask that we agree to allow Jennifer to reach out to State Board of Accounts and make that happen, so, you guys good with that? Okay.
Reach out.
Good.
All right, now I'll entertain a motion to adjourn.
I'll make that motion.
You sure you don't have anything else?
I ain't got nothing else. I'm with you fellas.
Oh, crap. Go ahead.
Bobby Knight died.
Oh,
Oh, no.
Hell, let's have a moment of silence.
Well,
Okay.
Anyway, Randy makes a motion to adjourn. Greg seconds, and I'll make that unanimous, so.